Prof, thank you so much for joining us. How much trouble have you had in trying to get undocumented people living in the capital vaccinated?
Thank you. Thank you for giving us the opportunity. We are mainly at this stage traveling in Pretoria and in the city of Johannesburg. So travel is restricted within the Gauteng, and that's what we are supporting the vaccination coverage at this stage. Thank you.
How do you get around the issue of having to present an ID document or a passport, which many of people living in the CBD or in South Africa as a whole just don't have, and how are foreign nationals being assisted too?
It is a national project, in fact, actually, which is University of Pretoria is a partner to it, that we are vaccinating the people who have either no document at all, or have a document which is legally not being used, like expired passport or expired asylum seekers paper. So there is a back end to the EVDS that which the university was given permission to use, and we partnered with the National Department of Health to use that system and register the people that who have no documents or have some documents which have expired already. Thank you.
Prof, how willing are undocumented people living in Pretoria, how willing are they to be vaccinated?
They are actually. So as I think you have mentioned that we have vaccinated over 4,000 people so far, and we could not cope actually with the demand of the need. The people wanted to be vaccinated, and this demand is picking up, and actually we were now requested to move out to another 5 provinces, the northern South African provinces that where the need is, and we would actually going to start there from either next week or the week after. Thank you.
Prof, what has your interface been like with the Department of Health in terms of their willingness to assist, and not just in Pretoria but nationally, because it makes absolute sense that everybody should be vaccinated whether they have papers or not?
No, it is. We get support from all the levels, from the national to the province and to the district health systems. And the University of Pretoria actually work through the district health system, and we get tremendous support. And like many instances that we could not cope with the demand. In many days, the number of people came for vaccination, and the Department of Health from the districts and the city, local municipal government clinics like in Johannesburg provide us all the necessary supports. So we are delighted and we are grateful for this partnership.
Prof, how do you make sure that if you're using a 2-dose vaccine such as the Pfizer, that those people who are undocumented do come for their next vaccination, considering they may not have a phone or any contact number?
So maybe let me pause here and explain to you the vaccination coverage the OPC research unit is doing. So we don't just vaccinate, we provide a care which is preventing the people to get the disease. And that includes also the doing a basic health check, identifying the comorbid conditions which expose them to the COVID, and take care of that. And this is where, again, our partnership with the district comes in, because when we identified problems like people are not getting proper treatment for diabetes or HIV, etc., then we do refer to them. So our approach is not just a vaccination, but a comprehensive healthcare approach, linking the people to the healthcare. So that is the first thing. So the reasons I mentioned this, because we actually had to bring them back to the health systems, not only for the second dose, but also to provide them the basic healthcare, and many of them are deprived of. Secondly, if you recall that we actually started even vaccinating the booster doses, which is started with the healthcare worker, which the University of Pretoria already started at its vaccination site in the medical school for the healthcare worker. And the people we are vaccinating, that we are actually requesting them to be available when they need to come back. Whether the second dose Pfizer vaccines for the children, now we are giving it, but also for the booster dose in 6 months' time. So they get a green booklet issued by the Department of Health called Linkers to Health Card, which we being used as a health record come ID, and that card actually being going to be used for them And we try to get as much as information from them through the person who is coming to us and their community leaders. And we get so far positive responses. The people are coming back for the Pfizer booster doses to us. So we really don't have any problem per se for that because we work with the local communities.
All right.
Thank you.
Professor, it's a wonderful initiative and I applaud you. I just hope that it's spread across the country because it makes absolute sense. Just because people don't have documents does not mean that they're not part of our communities. Well, that was Professor Debashis Basu, the head of public health medicine at the University of Pretoria.